right, so Dr. Lieutenant Kamal Kalsi, let's just go straight into COVID-19 and a lot that's happening. I have a lot of questions for you. We are currently looking at 2.3 million cases in the country and at least 120,000 deaths in the United States. My first question to you has to be, as a medical professional who's been in the field for all these months now, and you've seen the developments of COVID, what are still some of the uncertainties or unknowns with this virus that we're just not able to combat it?
Yeah, it's interesting. I think part of the uncertainty comes with surveillance. Now you're seeing in the news that in some states there's a decline. So certainly here in New York and New Jersey, we've been seeing a pretty steady decline in the number of cases. Certainly we see it as medical professionals in the ICU and the ER. We're not seeing as many COVID-related cases come through, so that's wonderful. But in other states like Texas and Florida, Arizona, they're actually seeing a huge surge of cases. And so I think that creates a little bit of chaos, because in some states, things are okay or getting better. In other states, things are getting much worse. So it's, I think it's important that we sort of not use a one-size-fits-all solution and try to tailor the solution to each area that is affected. So I think that's up to the individual governors.
As a medical professional right now that we have seen, almost a 3-month lockdown in this country, and we have seen so many measures happen across the board, what are your biggest challenges right now as a medical professional and some of your biggest concerns when we're looking at COVID-19 and its development in the month of June?
It's tough to predict where this is going to go,
Hmm.
right? Like I have my parents that live with us, my 2 kids, my wife, and it's hard to talk to your family and sort of tell them when things are going to be normal again. Like the kids want to be able to go back to Chili's, and they want to be able to go on vacations and go out to their parks and go on vacation and stuff. And I think a lot of that stuff is on hold. So, I think giving a good, honest answer to the public about what is coming,
Yeah.
I think is tough, because the answer is that it's, whatever is coming is not good. We've not really finished this first wave, and the second wave is going to be likely just as bad, if not worse.
Yes, and I'd like to have a discussion on the second wave and also reopening in just a little bit, but I wanted your comments on the drug trials and the current ongoings with the vaccination. How important is this vaccine in terms of getting a solution for COVID-19? And then how do we look at all of these drug trials that we keep on hearing about in the news? However, a lot of them have not really given a proper answer to fight COVID-19, if I'm right.
Yeah, you're right. When we talked about hydroxychloroquine earlier,
Yeah.
there were a lot of sort of mixed messages about whether or not that would pan out as a good treatment or not. I think most of us now understand, given the body of literature that's out there now, that hydroxychloroquine does not seem to work. There was a very, very good study done by the VA that shows that it can cause arrhythmias and other complications, but it doesn't really actually help anybody with COVID infection. So I think hydroxychloroquine as a treatment of choice or an agent of treatment is
Right.
out, but there's a few other medications that are being looked at, and I think the research there is still sort of ongoing. So I can't really comment on that, but right now, really the only weapon we have in our arsenal against this is social distancing and quarantine. It's worked in previous epidemics, and it's worked now too. To a lesser degree. We just have to come together as a community and wear masks, not just for ourselves but for other people. When you get into a car,
Yeah.
there is an expectation that you're gonna wear a seatbelt, And that there's that same expectation. If you're out in public, you should be wearing a mask because it is the socially appropriate thing to do. This is not political. This is just science.
Definitely, it is science, and that is why it's so important to understand what is happening. I want to reflect upon reopening because we have a lot of questions here that have come to ITV Gold as well. Do you medically suggest reopening is a smart idea? And when we're looking at reopening, is it safe for public to go into places such as the subway, the restaurants, salons, stores, and others? We're trying to figure out what is, a safety precautionary measure here.
Yeah, again, I think it goes back to each state, and depending on uh, what their levels of infection are. In areas where they have not seen any cases, sort of like, let's say, rural parts of the Midwest where they don't have a ton of cases, I think you could probably start to reopen a lot of those public areas safely. But it's going to take an individual personalized approach for each of those areas. And I think it can be done responsibly, and I think it should be done. But mass gatherings are very, very problematic. So if you're going to say, "Hey, I'm going to do a a 10,000 person indoor rally," I think that's a big mistake. Because that's a very, very high possibility of passing infection to the other people there, and that the same goes for large indoor parties, where you're going to have a few hundred people in an enclosed area. The
Yeah.
likelihood of transmission in those types of spaces is much, much higher than if you were to just open up a restaurant for uh, outdoor seating, for example.
So, but when you're looking at states, and I want to discuss some of these states with you real quick here. When we're looking at the states of New Jersey or New York, who have really sort of now contained the virus and are reopening, would you suggest people to go out and go to these outdoor dining experiences outside the restaurants, or would you still suggest that people stay inside as much as possible?
So I'll talk a little bit about Jersey because that's where I live. I think if you go to Hoboken, where my buddy Mayor Ravi Balla is sort of leading the charge, they've opened up all these extra seating areas outside all of the restaurants, and I feel we can do that safely. When I go there, I don't feel like I'm at risk because I think they've done it responsibly. Um, now, so I think Governor Murphy, Attorney General Gurwal, they've all sort of taken charge of the situation, and I think in certain parts of southern New Jersey, there were areas that started to open up a little too quickly and too aggressively, and in the public's interest, they stepped in and they said, "Look, this is too much too soon." So yeah, I think it's important to have good oversight to make sure that we do this safely and properly. Um, and I think that these guys, I think that the individual governors that are charged with taking care of the public's health
Yeah.
should come up with a solution for each of their states. The other question I get a lot by patients is, these COVID antibody tests that are out there now,
Hmm.
and as well as so you have the COVID nasal swab tests,
Right.
which go in pretty deep, and then you have the blood antibody tests, and I think there's a lot of sort of misunderstanding about the two. So the nasal swab, and so I think it might be valuable just to talk about that really quickly.
Yes, let's do it.
Um, so the nasal swab, the COVID nasal swabs, it's a deep swab. I mean, so it's going into your nose like that much, a good 3 inches into your nasal cavity, and where we take a swab out of each side, and we send that off for testing. Typically, it's going to take at least a couple of days in order to get that result back. But that nasal swab COVID test tells you whether or not you have the coronavirus right now, as of the moment that that the swab was taken.
Right.
The blood test, the antibody test, tells you if you've been exposed to the coronavirus over the last 3 or 4 months, maybe even 5 months. Because what happens is you get the coronavirus infection, and your body will rapidly start to produce these antibodies. But it's not going to produce these antibodies necessarily right away. People sometimes, their immune systems will kick in after a few days, maybe a week, maybe 2 weeks. It's sort of different for everybody. So that's why the antibody test is better at telling you whether or not you've been exposed over the last, several months.
Yeah.
But now, if you get the antibody test and it's positive, what does that mean? Even as medical professionals, we're sort of struggling with that question right now. We don't know if you have antibodies, like which I do. I had acquired the COVID infection a couple of months back.
Oh, wow.
And and I didn't have a cough or anything. I just had some mild shortness of breath, fever, and body aches. So the types of symptoms that you get there's a huge variety of those. So my antibody test came back positive. I don't know if that means that I'm more protected, but we think that if you have antibodies, it should mean that you should not be able to get reinfected, at least in the short term. Now, we don't know if this translates into anything long term yet.
Right.
The virus is constantly mutating and changing, like everything around us. So, 4, 5, 6 months from now, maybe during the second wave that hits us this fall, will we still be protected? I don't know. That's a big question for all of us.
Wow. It's quite incredible. In terms of testing, do you think there's enough testing, both type, being done in the country?
Yeah, I think we we have the availability of tests now. Finally, we were very, very behind the curve when it came to testing about 3 months ago. But now we finally have gotten enough tests, so we're starting to test, and it's wonderful because without the large number of tests, you have no way of knowing whether or not you were social distancing properly, or whether you're quarantining, or really any of your public health measures are working. So testing is really, really important to figure out how well you're doing. But I do feel like we have enough tests to test people, and I do feel like, at least here in New Jersey and New York, that we are testing them appropriately.
In terms of the second wave here, are we ready in terms of PPE supply and other necessities that were definitely very difficult in the initial weeks of COVID-19 pandemic?
I think that's a question that remains to be seen. I know a lot of my fellow physicians that are starting to open up their practices this past week are still struggling to obtain PPE, especially the smaller clinics and offices. So if they're struggling, that to me says that during the second wave, we're still probably going to be behind the curve. We're still probably going to see shortages of PPE.
Wow. I want to talk to you quickly here about the states, Florida, Texas, and California, because they are coming up with some record surges in their cases. Florida is above 100,000 cases. What is your prediction for a state such as that? And what kind of measures are really needed right now to contain the virus?
Yeah, there's a couple of really simple things that can be done. So while Florida is surging, as you mentioned,
Yeah,
the city of Miami, their mayor has said that everybody has to wear a mask.
yeah,
So I think that's a good first step, and then also continuing with the social distancing and not opening up things just yet. If I were medical professional advising Florida or
yeah,
Arizona or Texas, I would tell them to take a step back and go back to you know uh, limiting the size of gatherings,
yeah,
not allowing indoor congregations, or at least not allowing large indoor congregations, and continuing with outdoor restaurants, maybe closing down the beaches again. It just they're they're seeing more and more cases each day, and they are I think they are where New Jersey was maybe 2 or 3 months ago.
yeah.
So I think our public health department did a really, really great job, and Florida and Texas and Arizona and some of these other states really need to learn um, from the measures that we took here in New York and New Jersey.
I think that strictness is very important. Wouldn't you say that at this point in these states?
Yeah, yeah, and it's not really even being about being strict with your citizens. It's about social responsibility and discipline. You have to care about your community, and you show the fact that you care for your community by wearing a mask and by social distancing.
Mm. Cases are also rising in younger people. That is one of the biggest news of this week, where in the South and in the West, a lot of people are testing positive. Is this a big concern for us, the youth of the community? And if so, what would you suggest to them besides just wearing a mask and following social distancing rules?
Yeah, this is an important factor to consider because not too long ago they came out with research from one of the cruise ships, and what they found was 80% of the people on the cruise ship that were infected with the coronavirus had no symptoms, and they tended to be younger, and so uh, to me. Uh, that to me says that, look, your younger people may not have any symptoms, but they may be out there spreading this virus very quietly. So it's important that our youth and our young people understand that, and that if they're walking about or if they're just talking, that they may actually be transmitting a ton of virus into the air.
Wow. What do we do then? It's still so uncertain with this virus. How do we really protect ourselves?
It's hard. Uh, Sorry. I think it's tough to truly be 100% protected. Uh, but I think if we can do our social distancing, wear a mask, make sure we wash our hands and sanitize our hands, I think we have a shot at reducing the infectivity of this virus, and reducing the transmission.
Hmm. Have you seen any interactions between at high risk patients and COVID-19? Because a lot of the South Asian population unfortunately deals with at high risk conditions such as diabetes, cholesterol, heart diseases, lung diseases. So I'm trying to understand if you have seen those interactions.
Yeah, I have. Unfortunately, a lot of our elderly population is inflicted with diabetes and high blood pressure and cholesterol issues. So, at our, um, uh, I had an uncle that passed away this past weekend,
I'm so sorry.
and thank you. And uh, it was very sad, but the entire community, uh, uh, they they came to pay their respects. but it was done in a very, very respectful way. And it was done in a responsible way where people, um, where people were distanced. Uh, so I think, uh, look, life has to go on. We're not going to be able to contain everybody in a box
Yeah.
for long, long periods of time. And certainly the economy also cannot sustain that. But human life is more precious than the economy. Um, you know, my family and my friends, my loved ones, you can't put a price on that.
Yeah.
So I think what we have to do is we have to figure out that balance, and we have to figure out a way where we can uh, roll out these public health measures, keep everybody safe, and allow businesses to slowly start to open up individually, depending on their state's regulations. Um, again, in a very responsible way.
How do you recommend one works on their mental wellness right now? This has been a very stressful time period for millions of people across the globe. And with the economic ramifications and the healthcare ramifications, we're looking at a lot of distress. Are there any tips or some advice you can give to our audience?
Yeah, mental health is a really, really important aspect of overall well-being. And I know that a lot of my military buddies and friends have also had a lot of the same questions and concerns. So what I tell them is to make sure you take time out for yourself each day. Make sure you connect with your family. Exercise is an important part of that as well. So go out for a walk, go for a run. Figure out a good exercise schedule. Uh, and hand in hand with that is eating well and taking care of your body. I mean, a lot of us can't go to Gurdwara or Mandir or our mosque or our churches, but the body is our temple. It's our very first temple, and we need to learn to reconnect with our bodies and take care of them so that we can take care of our communities. And there's really no reason why we can't um, connect with our friends and family over the telephone, over video chat. I think that's important. I try to. There's a lot of friends now that I've connected with over the last few months that I hadn't talked to in many years. So there are some benefits. I love the fact that my wife is at home, and even though she's working remotely, and I enjoy seeing my kids at home as well. Um, I tried to convince my employer at the ER that I would love to work remotely too, but they've not allowed me to do that yet.
We can't have that. We need you in the ER. I really appreciate you for giving us so much insight. Right before I let you go on the show, I have to ask you about Seva because it's doing some incredible work. We have featured some of it. Just a little insight into, the works that is happening in terms of COVID-19 relief and perhaps how people can contribute if they're able to.
Yeah, absolutely. We've been partnering with a few different organizations, certainly the Punjabi Chamber of Commerce and others, to provide PPE to hospitals and clinics in the area. So anybody who is interested in donating money towards PPE, they can go to our website, www.seva.org, SAVA.org, and click donate. And in the box, comments box, just write PPE, and 100% of that donation will go towards providing PPE to hospitals and clinics that need it in the area. But we're still focused on opening doors in the military and police for Sikhs and other minorities. So we're still pushing the Navy, the Marines, the U.S. Public Health Service, and the Coast Guard to allow Sikhs to serve. But that's a whole other episode.
Yes, for sure. Well, I really appreciate you for your time here.